Good afternoon. Hello, everyone. I am so excited to be here with you at the end of this wonderful summit, coming together as members of what I call the Invisible Kingdom. I want first to thank the Autoimmune Association and Lily Stairs and Molly Murray for inviting me. I'm just so grateful to the Autoimmune Association for doing the work that they do to make autoimmune disease more visible. So I am a journalist and writer, and I have spent the last decade, probably even more than a decade, but the last decade, reporting on what I call the silent epidemic of chronic disease, including autoimmune diseases, that is on the rise in America and other countries. Out of that reporting, I wrote a book called The Invisible Kingdom: Reimagining Chronic Illness, which chronicles my own lived experience as a person with an autoimmune disease, the kind of disease that is often called invisible illness because the symptoms and the signs are hard to see in everyday life. And my hope in the book was that telling my own story of myths and missed diagnoses, and the invisibility that came with them could help others feel seen and heard. So I spent a decade interviewing researchers, patients, and doctors in the hopes that I might also offer context for what an autoimmune disease is, the challenges their treatment can pose to medicine, and in the end, to hope to capture something about the lived experience of those illnesses for many of us, with symptoms that can roam the body, with relapsing and remitting symptoms, in ways that lead patients to struggle sometimes to receive diagnosis and good care. So, when I think about the idea of an invisible kingdom, what it means to me is that that the more we raise our voices and come together, the more we become a force, right? By using the power of story and by making what we're going through visible, we go from being invisible alone to visible and legible together. And that's the real goal of, I think, the writing I do, and very much of the summit we're at over the past 2 days, which has been a really extraordinary time for me personally, just to hear so much research, so much sharing, so much that illuminates my own life. So if I think that the chat isn't open in this video screen, but I think elsewhere in the summit, the chat is open. There's a place to chat. And I'd really encourage you, as I'm talking, to maybe tell your own story of being a member of the invisible kingdom there. I'd love to know, was your journey to diagnosis an easy one, a difficult one? How does it feel to try to communicate your illness and its chronicity, its ongoingness, to your loved ones, to coworkers? Since we're coming to the end, what makes you feel visible and what gives you hope? Those are all questions I have for you. And excuse me, I have a tiny cold, so I'm just going to blow my nose for 1 second. But I want to tell you how I got here today. Let me tell you how I got here today. I'm going to share some of my own story. So my story is not unique. In fact, many of you are here with similar journeys. But at the time, it felt incredibly lonely and isolating. I first got sick 20 years ago in my early 20s, when most of my friends were healthy and unimpaired by any such sickness. If illness narratives usually have clear beginnings, a sudden fall, the doctor's test that comes back alarming, my own was murky. I like to say I got sick the way Hemingway says you go broke, gradually and then suddenly. This may be familiar to some of you. I started on a kind of roller coaster of symptoms just after college in the late 1990s. I had mysterious bouts of fatigue, strange neurological pains, dizziness, chronic pain, and drenching night sweats. I would go to my doctors only to hear, "You're probably stressed," over and over, or maybe it's anxiety. And so no one believed I was ill, and therefore not even I did exactly. And this medical gaslighting affected me quite deeply, I now can see. I really internalized the message that healthcare professionals were reflecting back at me. And I felt that whatever was wrong was somehow a problem with me. Maybe it was my fault for eating too much pizza or sugar or whatever it was, right? I spun out these stories. I thought maybe I am a hypochondriac. In various ways, I blamed myself, or I felt myself to be responsible alone for the management of my symptoms. And for years, I forced myself on, accumulating strange symptoms with no clear cause and no resolution. They seemed to exist outside of the usual timelines of getting a virus and getting sick and getting better, which is to say, they were ongoing. Then my mother died when I was 32. And the day after her death, I caught a virus and basically plummeted over a cliff. After months with swollen lymph nodes, fatigue, and unrelenting brain fog, I finally realized I really was sick. Something was wrong. And at that point, went on a quest to find answers, trudging from specialist to specialist, getting enough blood drawn to satisfy a thirsty vampire. Um, and yet each specialist would run their tests, look at their organ, as it were, and then tell me everything was normal and that I was fine. What I learned when I began writing The Invisible Kingdom and actually speaking to members of the Autoimmune Association was that, according to their work and surveys, it took at that time an average of nearly 5 years and 6 doctors for a person with an autoimmune disease to receive a diagnosis. That's an extraordinary amount of time, right? Today, we have made progress, mostly through advocacy and voices being raised. But it's still more like 3 doctors in 4 years, I believe. Because autoimmune diseases, as all of us know, can be systemic or affect multiple organs, patients can end up consulting different specialists for different symptoms. The patients I interviewed had usually seen a dermatologist, an endocrinologist, a rheumatologist, a neurologist, maybe an OBGYN, the list went on. Western medicine is structured in a way that makes it really challenging for those of us with systemic autoimmune diseases. When I began writing this book, there were no autoimmune centers in the United States. Now there's starting to be a couple. You think about the fact that we have cancer centers that are designed to treat care. We need to call for that, kind of coordinated care. And one woman I interviewed told me that she felt that doctors she saw were just, she put it, crossing their organ off the list. And in the end, she'd seen many doctors and they'd gone through every part of her body, your neurology, your liver, your kidney, and everything was supposedly fine. And yet she was incredibly ill. Right. So it's one of the things I try to do in the book is answer the question of why was it so challenging for me and others to receive diagnoses? And what I learned is what we all know, right? Our fragmented medical system is designed for crisis care, not chronic illness care. Its building block is the 15-minute appointment. I could barely list my symptoms in a 15-minute appointment, right? So I found that I would steel myself before appointments and yet never managed to ask even half of my questions without feeling somehow that I'd already imposed or exhausted the physician's generosity. Forced to advocate for myself in a fragmented medical system, I felt I was slipping through the cracks, which was something I heard from so many of the people that I interviewed for my book at that early stage of searching for answers. Like many who struggle for a diagnosis, it was hard to articulate how sick I was, even to my nearest and dearest. And I found that I began to grieve the so-called normal life that I'd thought I would have, a life full of dinners out with friends, hectic work days, travel, a family. And at times it felt really impossible to communicate the texture of lived day-to-day life, right, to friends, to colleagues, because what I was experiencing fell outside of our understanding of illness as a discrete thing that comes and goes, right, which is one of the real challenges of living with chronic illness, is that it doesn't go away. The stories we tell about illness tend to be stories of overcoming, right, and pushing through it, which, as we know, doesn't work for this kind of illness. More often than not, friends would say, but you look great. So a decade into my invisible illness, on a beautiful spring day, I spent a decade looking for answers, still did not have a diagnosis. I remember leaving a new doctor's office in Manhattan, breathless with hurt. Her office was busy and she had patronized me and rushed me out the door. And I felt in that moment that I needed an ally, right? But the encounter left me with a rusty taste in my mouth and a sense that perhaps I didn't deserve an ally. And this is one of the strange things about vulnerability that remains unseen by others, an illness that is unacknowledged by society or that you have to fight for the acknowledgement of, right? Which is that it's the sick person whose worldview warps often, the wounded one who absorbs the idea that one's condition is a distortion or something wrong, right? And all of that work goes on our shoulders instead of being something that we have to solve collectively. But in that moment, when I felt so alone, standing in the noisy Manhattan street, I remember the taxis were honking. I had one of those profound realizations that is so obvious now, but really took me years to get to, which was that as alone as I felt, I really was one of millions, right? I was part of this invisible kingdom. And that if we fought together for our voices to be heard, we could make things change. At the time when I was feeling this and thinking about this, autoimmune disease was really not a mainstream subject, but it is starting to become much more visible, again, thanks to the work of places like the Autoimmune Association. But we need more change to come, right? I began to read and report on autoimmune disease and came to understand that there were a whole host of social and historical reasons contributing to the invisibility that so many of us, I think, feel. We're ill in a way that stands outside of our common understanding of illness in the modern medical era, in which disease is tidy, replicable, it looks the same in person to person. It can be easily measured and clearly defined. And also modern medicine loves those diseases that are curable, right? If we have an autoimmune disease, we often have something that feels much more untidy. Our version of lupus may look a little bit different from our friend's version of lupus, right? And most of all, it's something that we have to learn to live with, and our physicians have to help us learn to live with. This matters because we are living through a silent epidemic of chronic illnesses like autoimmune disease that are hard to diagnose, hard to measure, and messy to treat. And as we all know, millions of people are suffering, sometimes in silence, with poorly understood illnesses that are marked by seemingly vague symptoms that relapse and remit, challenge easy diagnosis, and are subject, in their early stages at least, to sometimes inconclusive test results, right? As a result, medical practitioners sometimes gaslight or dismiss patients like us, leaving us in what I try to describe in the book as a state of ethical loneliness, a phrase I take from the philosopher Jill Stauffer, which is about this idea that simply by virtue of who you are, it's hard for you to be heard. Right. And this is one of the complexities that I think we all have to solve together, is how do we learn to listen, truly listen to patients' voices, to the voices of those who live with illness. We like to believe today that we're very rational about disease and immune to the kind of metaphorical thinking that afflicted the past, but we see that it's still there, right? Research shows that medicine still sometimes has such views when it comes to poorly understood illnesses. Often they can be seen in their early stages as symptoms of a deeper psychological or existential problem. And even though advances in our understanding of mental illness constitute one of the great successes of 20th century medicine, what a complicated thing is that patients with immune-mediated illnesses often confront a kind of reflexive categorization of their physical symptoms as mental ones if they're not showing up as clearly defined abnormal lab results early on. And this presents a barrier to proper care and research, right? If medicine can't see or name the problem, it can neither study it nor treat it, an uncertainty that can compound the patient's own uncertainty. The really good news here is that the work that's being done, the science that's being done, is starting to change that. We are getting better diagnostics, better tests, and we're starting to come out of this really murky period when it was hard for us to understand so much about these illnesses. So I feel a personal sense of hope after listening to some of the conversations here today and yesterday, and also conferences I've been lucky enough to go to over the past year. In my own case, because for so long my unwellness didn't take the form of a disease I understood with a clear-cut list of symptoms, I even interpreted it at times as a series of signs about my very existence. And many people I interviewed for the book did tend to think about autoimmune disease almost metaphorically, right? As some sign that something was wrong in their body was attacking itself, right? In a way that cancer patients whose body is also going wrong didn't seem to think about their bodies metaphorically. So one of the really interesting things I always talk about with people when we're sharing stories is what's your story and how can you change your story? Are there ways in which you still blame yourself even though you know you shouldn't, right? None of us should. What is that internal narrative that you carry with you, and how can it be shifted? When I was without answers at my most desperate, I really did come to feel that if I could tell a different story about what was happening, I could make myself better. And at least maybe I could make myself seen. Because at the time, it felt like there were two illnesses the disease and then the loneliness I felt at the fact that I didn't have a diagnosis and I didn't know how to explain what was going on to my friends and my colleagues and my loved ones. And so it took me years then, as you can tell, before I realized that the illness was not just my own, that in a way the silence around it was our society's pathology, and that that was an area that we could change through using our voices and our stories. In my own case, eventually, after this roller coaster, I was diagnosed with Hashimoto's thyroiditis, Sjogren's antibodies, and an autoimmune connective tissue disorder. With treatment and understanding and learning my own triggers, I've been able to come back to much of my life. I've had children, I have a family, I have the energy to write books and play with my kids. But I would say that one of the things I'm really attentive to and want to kind of make room for is that chronic illness can leave a kind of wound in you, right? Even when it's managed, even when you're living well with it, even when you have joy in your life. It changes your sense of possibility, of health itself. And it's something you live with. It's a kind of a presence in our lives, right? And so these conditions need much more study and collective sharing, which is why this week is so important. And the Autoimmune Association's work is just so, so important for all of us. I wrote The Invisible Kingdom to show that we need to come together to ensure that medical practitioners do not dismiss patients whose bodies live at the edge of medical knowledge, right? Who experience debilitating fatigue only to have doctors suggest that the problem is mainly psychological without due diligence done and trying to figure out, well, what's going on. One thing I like to point out is that, as the writer Susan Sontag observes in her great book, Illness as Metaphor, the less we understand about a disease or a symptom, the more we tend as a culture to psychologize and even stigmatize it, which is why we desperately need more research, more treatments, more data, more storytelling, right? Again, why the science is so important, because where science is absent, kind of harmful narratives can creep in, right? In a sense, I say, if every age has its representative signature disease, autoimmune diseases might be ours, because they are rising at what scientists call epidemic rates. They now affect from 24 million to 50 million people in the United States. We still have much to learn about them, and they require a kind of whole person care that we need more pressure to offer from multiple hospital systems. Excuse me. One of the things that makes them really complicated and sometimes hard to explain to others is it's not always clear what triggered the autoimmune disease, right? The evidence does suggest that multiple causes can trigger them, including the body's response to infections, genetic susceptibility, profound trauma, and more. Environmental contact with chemicals, all sorts of things, changes in our microbiome, all of these theories are being explored. So if one of the questions that I ask in my book is why were so many patients being dismissed and misdiagnosed, I think it is in part because there are conditions that resist the tidiness of the kinds of stories, the optimistic, hopeful stories we like to tell about illness, which are usually ones of powerful overcoming. I got sick, I suffered, I got better. That is not my story. My story, probably your story, some of your stories, is messy. I got sick. I got a little better. I got sick again. I got sick. I got a little better. I got sick again, right? How do we tell that story? Most people don't know how to listen to that story. And so we are forced on our own to become the advocates connecting the dots, right? We need the help of institutions and advocacy groups like the Autoimmune Association to take that burden off us as individuals and start to, again, turn this into the visible social problem that it is. The other reason it takes there's many reasons, it can take so long to diagnose is that 20th century medicine was not really built to treat these hard to measure systemic illnesses like autoimmune disease, long COVID now, myalgic encephalomyelitis or chronic fatigue syndrome. Rather, medicine was based on the rather incredible notion that all bodies respond roughly the same way to infection or injury, a perspective that is turning out to be oversimplified, right? The embrace of germ theory in the late 19th century brought the idea that illnesses are caused by an observable pathogen often, and that produces distinct and predictable symptoms. And that idea of distinct and predictable and replicable had a dramatic clarity to it, creating a tidy vision of disease in which, quote, each species of germ is supposed to incite one type of disease and elicit perfectly matched antibodies, as the writers and scientists Warwick Anderson and Ian McKay write in their book Intolerant Bodies, a short history of autoimmune disease. But autoimmune disease doesn't work that way. Again, it can be more variable, right? So the pivot to measurement and replicability increased survival rates from infectious diseases and gave us our wonderfully longer lives. But it did have one particularly complicated consequence, which was that patients who reported inexplicable ongoing problems after an infection or whose immune systems were variable and imperfect were largely ignored or dismissed by physicians when tests failed to turn up clear answers. Today, presented with a hard to identify disease, the modern doctor can sometimes shrug the patient off. And yet we don't always have all the diagnostic tools we need. So the increase in better diagnostics is making a big difference. As Noel Rose of Johns Hopkins, who's sometimes called the father of autoimmunity, he's no longer alive, but I interviewed him for my book. He told me that, certain conventional tests sometimes show the presence of disease only when 80% of the organ under attack has already been damaged. And as he put it, by that time, the train's gone off the tracks. So this, again, is why the advances in science, the advocacy all matter so much, because as science brings in clarity, so much of the harm of disease is going to be able to be staved off, right? But in this way in which, tests are unclear, you also often have patients going to the doctor and saying something's wrong, and the doctor saying, no, nothing's wrong, you're fine, it's in your head. So perhaps one piece of good news that's come through in my reporting, and I hesitate to call it good news, but in the midst of the tragedy of the pandemic, the scope of the problem of not only COVID-19, but of long COVID is helping shine a light on the role, certainly, that infection can play in autoimmune disease and its comorbidities. One researcher told me, I wouldn't be surprised if people are walking around with long Epstein-Barr virus or long influenza, but they've gotten written off. And as he put it, the difference now is that it is happening on such a huge scale that it is harder for the medical community to write off. And indeed, many researchers I spoke with over the past year believe that the race to understand long COVID will advance our understanding of autoimmune disease as well, and possibly transform medicine in the process, bringing care for complex chronic illness more into the mainstream. Certainly, we can hope and we can call attention to that need. In the meantime, it can be challenging to be chronically ill, right? One of the hardest things about being chronically ill is that sometimes people find what we're going through incomprehensible if they believe we are going through it. At times, I found that in my loneliness and preoccupation with what was happening, I wanted to be understood in a way that I couldn't be. And it was really only when I turned to patient communities and to other people's stories that I began to find that understanding and a new kind of story. One of those stories is told, if you can believe it, by a 19th century French writer who had syphilis at an age when syphilis was poorly understood. And he wrote something incredibly beautiful and painful that I think about all the time, which is, he said, pain is always new to the sufferer, but loses its originality for those around him. Everyone will get used to it except me. But it strikes me that that's why we come together in a place like this, because a place like this is where we know what it feels like to not get used to it, or to get used to it and then have that fall apart, right? And then build it again and have fall apart. So we tell our stories and we come together because each of us knows that feeling, and I think can find comfort or certainly consolation in sharing. Like many of us, I have both gotten used to and not gotten used to my disease, right? And living with illness. Sometimes I can put it in the back of my mind, and sometimes it comes flaring back to the center, and you know what I mean. But I feel very lucky that I have been able to come to a place in my life where I'm able to experience joy. And someone recently asked me what they think, come the meaning of life is. Like, if being ill taught me anything. And I said, first of all, if the idea is that getting sick makes you wiser and better, and I wouldn't have it any other way. Well, I would have it the other way, right? To be honest, I would choose to not have ever gotten sick. But since I have been able to find those moments of companionship and company in a new way, a kind of radical acceptance of other people's bodies and vulnerability that has been really meaningful to me. And also a stark reminder that a good life is a life in which we feel the capacity for joy, right? And we need to work hard to get to the place where every chronically ill person feels that capacity for joy, feels seen and recognized, validated, and understood in some sense. So I will just end by saying I remember at one point with my illness looking at a strange rash that had spread all over my arm and asking myself what it meant, right? Which is on the face of it a strange question. But what I was really asking was, why was it hard to get diagnosed and treated in this country in the 21st century? Why, as a woman, did I feel so often dismissed? Why was the invisibility of my illness so challenging to live with? Answering those questions would take up the past decade of my life. But they brought me into kind of radical contact with others. And what stood out above all when I interviewed others is that we want recognition of the reality of our experience, a sense that others see it, not least because human ingenuity might then be applied to our diseases so that others in the future suffer less than we have. And so it is important that we're all here together making that happen. A decade ago, again, autoimmune disease was really not a mainstream subject. Today, I hear people talk about it all the time. That visibility is shaped by the act of telling our stories, stories that are messy, that are chronic, that are painful, that are real, that have sometimes funny moments, but in the end, above all, are human. And I want to think as we come to a close here about the fact that your voices are changing the world of chronic illness, and that places like the Autoimmune Association and you are really shining a light where it needs to go, and change is happening. Each time we speak up, we complicate the reductive narratives that are handed to us, and we make more space for a medical system to do a better job at connecting the dots and taking us seriously. There is no end to chronic illness, right? Only a kind of ongoingness, a search for more and better ways to live with disease. But I think all of us are here today because we know that illness teaches us we can't go it alone, that we are better together, and that there is more work to be done. Our bodies may feel autonomous, but I think one thing that being sick with an autoimmune disease teaches you is that we all live in the nexus of a radical interconnection in communication with other bodies, and that communication is where hope lives. The story we are telling here today is one of moving from invisibility to visibility. It's a story of real complexity and not false tidiness. And it is the story that I was looking for all along. I really hope these past days have made you feel the same, that like me, you've learned something new, or made community, or found company, or found consolation thanks to the necessary work of this summit. I want to thank you for listening to me, and I want to, above all, thank the Autoimmune Association for the truly essential work it does, and hope you will join me in toasting with my coconut water to visibility and to change. Thank you so much.